Well, hello and welcome back to class. This is Clinicians Seminar for the College of Natural Health Sciences, Bermuda. My name is Dr. Delcina Bean Burrows, and this is lecture number 8, where we will be discussing part 2 of clinical reasoning in complementary healthcare. Our lecture 8 objectives are that at the end of today's lecture, students will be able to describe the functions of the holistic health practitioner in the assessment and evaluation process, describe what is meant by interactive clinical reasoning, describe what clinical guidelines are, describe what clinical indications and contraindications are with respect to assessment and evaluation findings, describe the process of making a referral to another conventional or complementary health practitioner. We begin today's discussion by considering the functions of the holistic health practitioner. The primary functions of the holistic health practitioner or complementary healthcare provider is to, number 1, facilitate client-centered care that addresses the holistic needs of the client. Number 2, determine the underlying cause or causes of imbalance, stress, and disease. Number 3, provide evidence-based treatments that will help the body to balance and heal itself. And number 4, provide evidence-based treatments that will complement other services or treatments that the client may be receiving. So let's take a closer look at the first function of the holistic health practitioner, and that is to facilitate client-centered care that addresses the client's holistic needs. When we seek to administer client-centered holistic health care, we as therapists are required to devise treatment goals that are meaningful enough to the client that he or she is willing to work diligently as a partner in the therapeutic process. So we use what is referred to as interactive reasoning. This is clinical reasoning and is referred to as interactive reasoning. And this is what we will use when we first engage the client, when we first meet the client, when we obtain information about their concerns. Sometimes we are able to get the client to fill out information with respect to health conditions, their forms, the past medical history. We're able to get them to complete that information ahead of the initial consultation when we will sit down with them face to face and decide on a plan of action to address their concerns. So this is referred to as interactive reasoning, the process of gathering the information, sitting down with the client, and devising a treatment strategy or a plan of action to address their concerns. And so interactive reasoning involves getting to engage the client. You're going to engage the client. You will come to know the client as a person. You will understand the health conditions, illness, ailments, or the imbalance from the client's perspective. Interactive reasoning is also to individualize intervention, to communicate trust, acceptance, and hope, to use humor appropriately to relieve tension, to construct a shared language, to determine if the consultation treatment session is going well by accurately interpreting the meaning and motives behind what the client says and does. And this is going beyond just being cordial. You are really delving in and getting to know and interpret what the client is telling you. Interactive reasoning is also to adjust your interactions according to what is needed. So you will either mirror the client or you will adopt a different tone or a stance. For example, what we mean by this is that you will be supportive of the client, and you may have to console the client if the client is working too hard or they're being too hard on themselves. you may have to be a bit more supportive and nurturing in that regard, because oftentimes you will have people who will come in and they are just so very hard on themselves. I mean, we as therapists ourselves, we know sometimes we're hard on ourselves. So if you get a client who comes in and they're very hard on themselves, what we want to do is provide more of a supportive and nurturing tone so that the client can achieve a balance, a delicate balance between being too hard on themselves versus not doing enough in order to overcome whatever challenges they're facing. So we want to provide support to the client if they need that. And on the other hand, we may have to be the ones to facilitate a bit of a more gentle challenge. And this is where you want to encourage the client to maybe work harder in terms of achieving their goals and things like that. And it's, as I said, it's a gentle challenge, because sometimes a client may come and they may figure that just by virtue of the fact that they are in a treatment facility per se, that it means that everything is going to be magically done to them. They don't necessarily see that they actually have to put in some work, and they are a part of the process just as the therapist is. So you may have to gently challenge them and encourage the client to work just a little bit harder to achieve whatever goals they have to set for themselves. And interactive reasoning is also the ability to make decisions in the here and the now with the full participation and consent of the client. So, in other words, what you're going to do is, when you are interacting with the client, when you're sitting and you're listening, especially in that first initial consultation period, when you're getting to know the client and you're coming to an understanding as to what they would like to achieve, what goals they would like to set in order to address whatever their concerns are, you want to make sure that those decisions are agreed upon and made right there at that time, because that's what's relevant. The here and the now is what is relevant. So you get the client to participate in the decision-making process in terms of what treatment is going to be enacted, or if you, in some instances, if you're not able to treat the client but you're having to refer, they will be an active participant in the decisions that are being made with respect to their well-being. So this is how we go about encouraging, facilitating client-centered care that addresses the client's holistic needs. Now, the second function of the holistic health practitioner that we're going to look at more deeply is number 2, determining the underlying cause or causes of imbalance, stress, and disease. Getting to the root of underlying causes of diseases, stress, and imbalance is at the heart of what we do as holistic health practitioners. And so how we do that is we perform an examination. The examination is carried out by way of first collecting data. The data that I had mentioned earlier, sometimes we are able to get the client to fill out ahead of time any health questionnaires that we may have or surveys that we may have, so that when they do meet with us, you already have that information and you can save some time when you have your initial consultation. But certainly data collection is going to be the first important thing that you're going to do. You're also going to perform observations, what you're able to see in front of you in terms of the client, what they are displaying physically, what they are verbalizing, what they're telling you in terms of the reason as to why they're seeking your services. You're also going to perform a physical examination, and this is usually involving the musculoskeletal exam. A musculoskeletal exam includes things such as range of motion of the joints, muscle strength. You're going to do manual muscle testing, testing for sensation, all those things that we covered in the practical training lab. This would be coming under the title of the musculoskeletal exam. You will do things like their vital signs, such as maybe take their temperature, also their blood pressure, heart rate, those types of things, and also a skin analysis depending on why they're seeking your services. So this will come under the broad heading of examination. And then also we may have to perform more in-depth assessments of an area. This is where we refer to a evaluation. So when you have to do a specific, more in-depth test for something, then you would perform it at that time after you've done the physical examination. So say, for example, you are testing the person in terms of sensation in the foot, then you would use the 10-gram monofilaments to test to see if they are sensing sensations normally in the feet. So that would be a more specific evaluation. Okay, so then the next thing would be the diagnosis. And when we say a diagnosis, we are meaning a clinical diagnosis, not a medical diagnosis. And the clinical diagnosis is what you see as a clinician in terms of what is going on with the client. So you would make that determination after you have performed the examination, you've collected the data, you've made your observations, you've heard what the client has had to say with respect to where their concerns are and what's going on with them, whatever signs or symptoms they are displaying. And you've also done more evaluation in specific areas if it is warranted. And then you come up with a clinical diagnosis from the standpoint of what you are seeing clinically. So you may say something, the client is exhibiting signs of being under a great deal of stress, and therefore we are going to give this type of intervention or treatment based on what we are seeing clinically. So you always cover yourself by saying this is just your clinical observation, or you can say a clinical diagnosis based on your area of expertise, and you make it very clear that you're not giving a medical diagnosis. And we will talk more about how you actually document these things in subsequent lectures that will come up in this class as well as in our practical training class lectures. And then the prognosis. A prognosis is simply predictions as to how things should progress with and without treatment specific to your area of expertise. So if the person they're coming in for stress and you decide that you're going to give them a, let's say, reflexology treatment, you can say something to the effect that client is expected to do well with reflexology treatments. After so many treatments, they're expected to do well, and we should see signs of balance occurring in the body or healing occurring in the body if we proceed with this course of treatment. And likewise, you may also say something to the effect that without intervention, the client will probably not do so well, or they may even deteriorate, or they may have some kind of health crises as a result. But you always stay within your area of expertise. You only speak to the things that you know will happen, or are in all likelihood something that will happen in the event that they do not address their concerns that they are having. And even though we study pathology and we understand the disease process, and we can very predictively say with all certainty that certain diseases, based on their course of action without any kind of intervention, whether it's our intervention or conventional healthcare, we know that persons will not do so well. Some diseases are very debilitating, some are life-threatening, and some just take away from the quality of life. We can say that with certainty. However, when we document with respect to holistic healthcare, we always want to stay within our lane and not step on anybody's toes, because we know that only medical doctors are the ones that can give medical diagnoses. So we always want to respect that. And in cases where we are working in integrative medical settings where persons have already been diagnosed, then we can always say things like we concur with the findings based on what was already said, how the client's already been diagnosed. They've been diagnosed with whatever the condition is, and yes, we see manifestations of these things such as joint weakness, or I should say lack of joint range of motion, muscle weakness, and fatigue, those kinds of things. We can always say how we concur with whatever the medical diagnosis is, but we always want to make sure that we're staying within our lane. And then in terms of intervention, intervention is when we are determining and subsequently administering the best course of action in terms of treatment and client management to address the client's needs. So we do all of these things to, again, address the underlying causes of imbalanced stress and disease. It's the examination, the evaluation, the clinical diagnosis, the prognosis, and the intervention. Those are the things that we do to address the underlying causes of disease as holistic health practitioners. So now let's discuss the third function of the holistic health practitioner, and it is to provide evidence-based treatments that will help the body to balance or heal itself. And as we discussed in lecture 2, as well as we touched on it in the first lecture that we had for Clinicians seminar, but we certainly did talk about it in more detail in our second lecture for Clinicians seminar, and that is that evidence-based practice, or EBP, is the standard for healthcare as well as education and public policy. And often it is understood to imply that research-based evidence is the primary source of information, but in truth, EBP is defined as integrating the best available evidence with clinical expertise and clinical experience, along with client values to guide clinical practice. And when we talk about EBP, we're talking about the best available evidence, which implies that we utilize evidence that is current and available. Sometimes this means research articles from peer-reviewed articles, and sometimes it's just the best available evidence that comes from clinical or expert opinion or anecdotal outcomes. Okay, so we always look to combine clinical expertise with the best research evidence that is available, along with the client's values. This is what is considered to be evidence-based practice, and we certainly do this in complementary healthcare. We do this in holistic healthcare. This is a vital function of the holistic health practitioner. So what I'm going to do is refer you back to lecture number 2 for Clinicians seminar, where we discuss how you search for evidence to inform your practice. I'm not going to go into much more detail in this particular lecture about that. We will be talking much more about evidence-based practice, certainly in subsequent lectures. But for our purposes here, in terms of describing the functions of the holistic healthcare practitioner, it is to provide evidence-based treatments that will help the body to balance and heal itself. The things that we do in our treatment are evidence-informed, they are evidence-based. We are not guessing our way through this, and this is what makes us holistic health practitioners that have a sound scientific basis for what we do. So now the fourth and final function of the holistic health practitioner that we are going to discuss is number 4, to provide evidence-based treatments that will complement other services or treatments that the client may be receiving. And this is when the client is seeing the holistic health practitioner, but they are also seeing persons in the conventional medical field as a part of managing whatever their condition is. So the word complementary means in addition to. So we know that complementary medicine is a term used for a wide variety of healthcare practices that may be used along with standard medical treatment. The treatments that we employ as holistic health practitioners should enhance conventional medical treatments that the client may be receiving. The complementary treatments should not interrupt or interfere with conventional medical procedures. So you know right away if you have a client who has something going on, they're receiving some kind of treatment, but while they are receiving that treatment, they are not able to receive your services, then you know right away that what you would propose to do is not complementary to, because it will interrupt or interfere with them being able to receive their conventional medical procedures. Also, complementary treatments should be safe to administer, and for the most part, they should not trigger an adverse reaction. This can sometimes be an outlier situation, but for the most part, when we administer a treatment to a client in a complementary fashion, we should know for sure that it is safe and that it will enhance the other services that they are receiving. Okay, so such as if we're using reflexology or aromatherapy or some other modality, such as maybe some form of massage, or maybe Bowen therapy or kinesiology techniques. These should be things that enhance the other services that they are receiving. And then complementary treatments do not take the place of conventional medical treatments when medical treatment is what is needed. So we want to be very clear on that, in that, yes, we can manage people holistically, who just individuals who come and seek our services on their own, and we will provide them a service that's within our scope of expertise. But when it is clear that someone needs medical attention, they need medical treatment, then anything that we would propose to offer that client, it should not in any way take the place of conventional medical treatment when that is what is needed. So I always like to give the scenario of if someone has a broken leg, we are not going to sit up here and say, okay, well, just take this herb and your leg will be healed. No, we would make sure that that person goes to the appropriate physician to get the leg put in a cast. If surgery is needed, then that's what they will get. And anything that we might do, such as maybe we would prescribe an herbal remedy that helps, that supports the skeletal system, the musculoskeletal system, that will help to facilitate healing in some regard. But we're not going to administer that in the case of them, instead of them receiving medical treatment. That's just not what we do. And also, complementary treatment should be applied scientifically, which means that the practitioner uses sound research, as we discussed earlier, to inform his or her practice. So in other words, I know that I'm going to use a treatment that will complement my client's condition and complement the services that they are already receiving. I'm making that decision, and I'm doing it with the full knowledge of what the research is saying out there in terms of the modality that I choose to use. So, for example, in pain management, if acupressure is indicated, that's something that we may use to help a person with maybe arthritis to manage pain, maybe someone who is suffering from complex regional pain syndrome. You may use something like acupressure, or you may use something like Bowen therapy, or you may use something like acupuncture. There are just so many things out there, such as, and also reflexology. Reflexology is really showing itself to be a go-to modality for pain management in many areas. Well, you would apply the reflexology treatment with the knowledge of what the literature is saying, the research that is out there on these techniques and how effective they can be to help the person manage their pain while they may be taking pain medications that have been prescribed to them by their physician. So we do what we do in an evidence-informed manner. This is how we function as holistic health practitioners. This leads us to our discussion on clinical practice guidelines when we discuss using sound information, sound research, and sound sources to inform our practice. We will discuss clinical practice guidelines. Sometimes it's just referred to as clinical guidelines. But the definition of clinical practice guidelines is that it is a systematically developed statement designed to assist the clinician and the client or patient in the decision-making process about appropriate health care for specific clinical circumstances. CPGs recommend a course of action. Clinical guidelines are meant to help to ensure that clients or patients receive appropriate treatment and care. For instance, the guidelines on cervical cancer include recommendations on the diagnosis and treatment, as well as recommendations concerning psychosocial support, rehabilitation, and follow-up care. Clinical guidelines summarize the current medical knowledge and weigh the benefits and harms of diagnostic procedures and treatments, and give specific recommendations based on this information. They should also provide information about the scientific evidence supporting those recommendations. Clinical practice guidelines must be updated regularly. Now, unlike directives, guidelines aren't legally binding. In other words, doctors don't have to follow the recommendations if they don't think that they are suitable for certain patients or clients. But deviations from guidelines must be justified. For some medical conditions, there are also easy to understand guidelines for patients. They are freely available on the internet, and the German Association of the Scientific Medical Societies offers an overview of the currently available guidelines for patients in Germany. So how are clinical practice guidelines developed? Ideally, clinical guidelines should be developed systematically, in other words, following a certain procedure. First, a guideline committee is formed, including specialists to cover all the important aspects of the medical condition in question. The committee is usually led by a member of the medical association responsible for the medical condition. It collects as much information as possible from different sources and assesses the information based on predetermined criteria. The various assessments and opinions of the committee members are discussed and taken into consideration when writing the guidelines. In other words, the recommendations are consensus-based. The committee members have to declare any conflicts of interest. For instance, they have to say whether they have worked for a pharmaceutical company that makes medication to treat the medical condition that the clinical guidelines are being written about. So how can you recognize good clinical guidelines? Well, good clinical guidelines should be based on up-to-date scientific knowledge, and it should be possible to follow the recommendations in daily medical practice. International uniform standards are now used worldwide for the assessment of clinical guidelines. In Germany, the Association of the Scientific Medical Societies coordinates the development of clinical guidelines, and it divides guidelines into 4 categories. The first is S1 guidelines, and these are guidelines summarizing the recommendations of experts. They do not systematically compile and assess the medical knowledge in the area in question. So the recommendations made in the S1 guidelines category aren't very reliable. Then there is S2K guidelines, and the S2K guidelines are developed by a committee of specialists in the medical field in question. The recommendations made are consensus-based, and because medical information isn't systematically collected and assessed here either, the information that the recommendations are based on are not very reliable. And then we have S2E guidelines category. And here the guideline committee systematically compiles the medical knowledge from different sources, but if the members of the committee disagree, they do not use a consensus-based approach to develop the guidelines. And then we have S3 guidelines. This is the only category of guidelines that meets all of the following requirements. The guideline committee includes experts representing various fields, various areas of the field in question, and the medical knowledge is systematically collected and assessed. What's more, if different members of the committee have different views, a specific procedure is followed in order to develop consensus-based recommendations. S3 guidelines are the most reliable kind of guidelines, but they also involve the most effort. It can take several years to develop them, and when S3 guidelines are developed for doctors and healthcare professionals, patient guidelines are usually developed as well. With conventional medicine becoming more and more integrative, good clinical guidelines include evidence to inform complementary health practice as well. But primarily, clinical guidelines have been developed in conventional medicine for the use of conventional healthcare practitioners, but there is a trend now where we are developing within the field of complementary therapy our own clinical practice guidelines for managing our clients. And as I mentioned, with medicine becoming more and more integrative, we will see where complementary health care practices are readily being included in the management and treatment for the development of clinical guidelines when it comes to the person and in terms of holistic care. So very exciting times right now in terms of clinical practice, and we as holistic health practitioners, we will stay informed when we search for evidence to inform our practice. We look for things such as, are there any up-to-date clinical guidelines with respect to utilizing whatever I'm going to be utilizing to help assist my client to achieve balance and wholeness and to support the body's ability to heal itself. These are important tools that we can access as we seek to give our clients the most in terms of treatment. Now let's discuss what are clinical indications. From a holistic health practitioner perspective, a clinical indicator or indication is a sign, symptom, or a set of circumstances that will lead to a particular modality of treatment being recommended to address the client's particular health needs. Clinical indications are determined after the client has been fully assessed and the clinician has taken all known information about the assessment results, the client's condition, and the client's goals, concerns, and expressed wishes into account. An example of a clinical indication may be recommending reflexology treatment to a client who has sought the services of a holistic health practitioner for general stress management. After the clinician conducts the consultation and physical exam, and he or she has determined that there are no obvious health concerns, then the client would be a great candidate for reflexology treatments. Clinical aromatherapy may also be indicated in that the client may be encouraged to inhale lavender and/or clary sage essential oil before going to bed at night. These same essential oils can be incorporated into a reflexology treatment session when attempting to clear the energy pathways. So when we are talking about clinical indications, we are making a determination as to what would be the best course of action in terms of treatment to address a client's needs. And so we would determine this after we have conducted the assessment process and we have all known information at that moment in time to make a recommendation that a particular treatment may be indicated based on the results of the assessment. Now, we should also point out that clinical indications are also referred to as procedures and steps that, when implemented, will have a beneficial effect and support the body's ability to heal itself or to balance itself. Clinical indications can be applied with a high degree of certainty that they will not cause harm, but there are always exceptions to this rule. This is why we must always inform our clients as to the possibility of an adverse reaction or healing crisis occurring after a treatment session. But for the most part, when something is clearly indicated in terms of a treatment, there is usually not a harmful effect that occurs, especially if you have taken all the relevant information into account and the client has been completely open with you. There's nothing that has been concealed from you that would cause you to not recommend a particular course of action in terms of treatment. But we always say there's always a blind corner, so you're going to proceed with caution. There are always outliers out there. But for the most part, a clinical indicator is something that can be applied with a high degree of certainty that it should have a beneficial effect to your client, and this is what we want. Let's talk about contraindications. A contraindication is something that will prevent you from performing a service. Contra means against, that is, an indication against treatment. Contraindications can be either general, and you will be unable to treat the client, or specific, which will prevent you from working over a specific area of the body. Let's specifically talk about general contraindications. As complementary holistic health practitioners, we need to be knowledgeable of the general contraindications as it pertains to various health conditions and the specific treatments that may aggravate the health condition or cause an adverse reaction. For example, hot stone massage is generally contraindicated for persons with diabetes, as their skin is usually sensitive to hot as well as cold modalities, which can result in the person experiencing a severe burn, even from just a few minutes of a hot stone treatment. And at this stage, we are just learning about the human body. And when we get further into the program where you learn about specific modalities that are used, you will become very familiar with which treatments are contraindicated for your particular health condition that a client may have. And so for now, it's important to understand that generally speaking, there are contraindications, and we will become very versed in what those general contraindications are specific to various health conditions that your client may or may not have. So the following conditions may render specific treatments to be contraindicated: diabetes, cardiovascular conditions including hypertension, hypotension, thrombosis, embolism, phlebitis, angina, and pacemakers; any dysfunction of the nervous system, such as anesthesia, which is a loss of sensation, or epilepsy; if the client presents with a high temperature or a fever; any recent operations; any unexplained swelling or swelling glands; pregnancy in the first 12 weeks and wherever it is applicable; postnatal 6 weeks; any general infection, whether it is viral, bacterial, fungal, or any infestation such as head lice; and of course blood diseases including HIV unless under specialized supervision, and hepatitis. Now let's talk about contraindications specific to an area of the body: open wounds, cuts, and abrasions; acne rosacea; acne vulgaris; pustulant skin; focus of sepsis, boils, bites, and stings; dilated arterioles; telangiectasia; varicose veins, where you can only work above the affected area; warts, and moles. Also contraindicated in specific areas, we have over the abdomen during the first 2 to 3 days of menstruation. You must be cautious with your patients that are fitted with an IUD, an intrauterine device, over the abdomen. Eczema, psoriasis, bruising, recent fractures, recent scar tissue, and sunburn. There are occasions when medical guidance will be necessary before treatment, and general practitioners, some, may be reluctant to getting involved if they did not refer the client to you and your practice in the first instance. Some GPs will charge a fee even if it is just for a signature to acknowledge a response, and clients will find this off-putting. However, if a prospective client genuinely wishes to be treated, it is in their interest to gain the necessary information. They will also appreciate the reason why it is being requested. And again, as I mentioned, a lot has to do with the type of setting that you're going to be working in. Obviously, if you are working in an established practice with a physician on board, then these won't be issues. However, if you're working as an independent practitioner, then this is where sometimes you have to seek out the additional information, and you may have to require your client to get permission from her GP or his GP as to whether or not the treatment that they're seeking from you, if there are any concerns or contraindications as the physician sees it. And many times this is not necessarily a big issue. Most physicians want the best for their clients, and so if they really know their client, then they'll be able to determine whether or not something that they're seeking is going to be detrimental to their health. This is where it becomes very important for us as natural health practitioners to introduce ourselves to the persons in the medical field, the physicians that we know that practice in our area, in maybe in around our neighborhood or close to where we're going to be practicing. And it's very important to build a rapport. And we will talk more about that when we look at how do you establish a practice, what things do you need to do in terms of getting people to know who you are, introducing yourself to healthcare professionals, that kind of thing. So this is where all of that becomes necessary and comes into play. So we will speak more about that, but for now, just understand that Some general practitioners may be a bit reluctant, but again, it's how you manage the situation. The main reason for requesting additional information is for the safety and well-being of your clients. So when you're seeking medical advice, you want to keep the following points under consideration. The client should be the one to contact their physician. And remember that you are not asking for approval or permission to carry out your services. Some physicians will not want to get involved, and this arises when they are asked for approval and as such do not have direct control over the treatment. By giving their approval, they may also be accountable for any adverse results. Many physicians are also unaware of what the treatment may involve, and as such, an information leaflet may be a useful addition. You are inquiring as to whether, in their medical opinion, there is any medical reason why their patient is unsuitable for the treatment. Clients are often unaware of the implications of their condition, and sometimes clients who are taking medication are not sure what the medication is for. If you need to contact the client's physician, do not refer to the client's condition by name, even if the client has discussed this openly with you. If you are unsure of a condition but suspicious that it needs medical treatment, again, do not state the condition by name. Remember that only a physician is medically qualified to offer a diagnosis. And again, most of this comes into play when you are working as an independent practitioner. But if you are working in an establishment whereby, let's say you are a consultant service provider so many days per week in an established medical practice, then you will have access to this information because a physician, let's say a medical practice that's using an integrated holistic medical approach, they will have you on board because they know specifically what kinds of treatments would benefit their clients. And so many of the contraindications or any information they would need to know about what kinds of treatments you're going to be carrying out, they will already be well versed in that. So some of these things are changing. You will be surprised, however, that we still have physicians out there who do not accept holistic complementary healthcare services. Many of them still believe that it is pseudoscience. Some say it's witchcraft. And you will be surprised how many people still have certain beliefs about complementary medicine and complementary healthcare and holistic healthcare. So you have to really look at the situation that you are in, and you always have to assess it based on what your client is presenting with at the time. But these are things that you have to be aware of so that you are always carrying out a professional service to the best of your ability, and as you had taken the oath, first do no harm. So as I mentioned earlier, when in doubt, do not treat. Now let's talk about alternative practices, and there are times when you may opt to use one of these practices, and this is where a client demonstrates an understanding of their condition, and the client can consult with their physician directly, who can then discuss with them their suitability for treatment. And in this instance, the doctor can then advise the client directly of any restrictions or precautions. Alternatively, you could write directly to the physician, citing the information above, meaning that the client is aware of their condition and they also understand the implications and suitability for treatment. You can give details of the client that you are intending to treat with what the treatment is. Also, you can then request to hear back from the physician within a specified number of days. If you do not hear back, you can inform your client and then allow the client to make the decision as to whether or not they will proceed with the treatment. But in both of these instances, the information is then noted on the client's records, which the client signs to verify the content. So you are covering all of your bases here, and you are also empowering the client, making sure that everyone is in agreement with the procedure, that we've done our due diligence, as it were. We have consulted with the physicians, the client's physician, and we're going to proceed, or maybe we're not going to proceed. But in any event, you're going to follow this to the letter in terms of making sure that we always suss out as much information as we possibly can, all for the well-being of our clients. So now let's talk about observations before proceeding with your treatment. Once you are happy with the information you have gathered from your oral questions and you have ascertained that there are no obvious contraindications, the client can be prepared for treatment. Always check the client for visual contraindications. There may be skin blemishes that need an explanation, or scar tissue that the client has lived with for so long that they have forgotten to mention, or blemishes of which the client is unaware. Even at this stage, you are perfectly within your rights to refuse treatment. You want to do it tactfully, however, and where possible, offer an alternative treatment. Let's talk about contraactions and adverse reactions. The client should be made aware of any adverse reactions that they may experience without alarming them. It is a good idea to have a leaflet detailing advice and aftercare for the client to take home. After treatment, your client will be relaxed and they may forget what you have told them. Some reactions may occur both during and after treatment. While changes are a positive step to the body reestablishing equilibrium, these need to be manageable and symptoms should not persist. Let's talk about the healing crises. A healing crisis is the name given to noticeable adverse reactions. A client may experience a return or increase in symptoms before they notice an improvement. This should only be temporary. Where there is a long history of imbalance and illness, this is more likely to occur. It may also be an indicator that instead of having a healing reaction, the client has been overtreated and the body has been thrown into a crisis. Or it may be a reaction between treatment and medication that the client is taking. If an adverse healing crisis occurs during treatment, it should be stopped immediately and the treatment re-evaluated. So now let's talk about referring the client to a conventional healthcare provider. As was discussed in previous lectures, as well as this lecture, there will be times when it is necessary to refer a client to a medical specialist outright. This is usually the case when a client is experiencing acute signs and symptoms of a physical and/or emotional condition or a crisis. We should follow these steps in such circumstances. First, we should call 911 if it is a medical emergency, and we should also administer first aid. Number 2, if it is a non-medical emergency that warrants immediate attention, you want to try to establish who the client's next of kin is, as well as the family physician, so that you can establish contact. Number 3, if the situation warrants that another conventional healthcare provider intervene, you want to calmly explain to the client that the expertise of such a professional is better suited to address their needs at this time. You may also explain how you, as a holistic health practitioner, can see the client once the immediate concern is properly addressed. You always want to leave the door open for future interactions and future business. And number 4, ask the client if he or she would like for you to initiate the referral process to whoever the appropriate conventional health provider is going to be. You always ask them, would you like for me to help you in this process? I can make contact with this individual that I'm going to be referring you to. And if they say yes, then you can go ahead and make that contact. If it's possible, you can make it right there and then while the client is sitting there, and so that they'll be empowered to be a part of the process as much as possible. But if they say no, they can go ahead and make that referral, then you leave that up to them. But you always want to include the client in the process, because this is their body that we are talking about. So this is how you would make sure you would, as I mentioned earlier, you would first make sure that if it's a medical emergency, you want to contact 911 right away. And then if it's a non-medical emergency, the next phase would be to get in contact with the client's next of kin or their family physician if that is known. It's all about making sure that the client enters the healthcare system so that they can get the care that they need at the appropriate time. Now we will look at referring the client to another complementary health practitioner. There may be times when it is appropriate to refer a client to another complementary health practitioner. And the reasons being that the practitioner may offer a service or has expertise in an area that you as the clinician do not. For example, you may have to refer a client to someone who does acupuncture because the client specifically said that they would like to receive that kind of service. So if you do not offer acupuncture, maybe you offer acupressure, but if you do not offer acupuncture specifically, then that would be an example of when you would go ahead and refer the client to someone who specializes and has expertise in those areas. And then number 2, you and the client, for whatever reason, are not gelling, and therefore you cannot facilitate healing. And this happens. It could be, and when I say not gelling, it could be a number of factors that come into play. For example, maybe the client is too familiar with you, or you're too familiar with that person, and maybe they cannot relax to allow you to perform the role as a clinician. Maybe they see you more as a friend, and maybe you as the facilitator maybe feel somewhat uncomfortable about that because maybe you feel like you know too much about the individual, and therefore you cannot really get them to a state where both of you can be objective about what it is that you're going to provide in terms of treatment. So there are a number of factors. We also talked in the practical training lecture about sometimes if there is some kind of maybe a physical attraction, if the client is of the opposite sex or what have you. It could be a situation where the client has indicated that they are interested in you more than just from a professional standpoint. And if that is the case, then definitely you will not want to proceed in that instance. So, you know, there's just a number of reasons as to why you may not be gelling. So you would not be in a position where you can properly facilitate healing. And then, of course, there is the obvious conflict of interest. Okay, so a conflict of interest may arise whereby you have a relationship with this individual in some other capacity, and of course you're not able to be objective. So there are a number of reasons as to why it may not be appropriate for you as a complementary health practitioner to treat a particular client. So when this happens, what you want to do is you want to calmly explain to the client why it would be appropriate to refer them to another practitioner based on any of the above scenarios that we just discussed, and you want to offer to assist the client in the initiation of a referral. You want to make contact with that practitioner to whom you are making the referral, but you only do this upon the instruction of the client. So if the client independently sought your services, in other words, they came to you on their own, they weren't referred maybe by a physician or someone else, then you always give them the opportunity to make contact with whatever other complementary health practitioner is going to be recommended at that time. So you only initiate the process upon their instruction. It's always about empowering the client. It's always about including them in making the major decisions when it comes to how they will be managed, how they will be treated in the process. And I have included the references that we made mention of in today's lecture. And so if you want to look the information up further, here they are. Okay, so we have reached the end of today's lecture, and this was a long one, I will admit that. But for assignment number 8, I'd like for you in an essay of no less than 200 words, discuss the following: the primary functions of the holistic health practitioner in the evaluation process. What are the important components of interactive reasoning that are used to facilitate client-centered care? What are clinical guidelines? What are clinical indications and contraindications? And I'd like for you also to describe the process of making a referral to either a conventional or a complementary health care practitioner. And as always, if you have any difficulty with this assignment, you may send me a text message or an email. My office hours are always on Thursdays from 4 to 6 p.m. Had to think about it for a minute there. This essay is due on a Sunday by 11:55 p.m. And with that, I will see you in the next lecture.